I'm Vinnie Politan. The subject of my investigation is a 19-year-old teenager named Alexee Trevizo. And Alexee Trevizo was pregnant. And the question is, did she know she was pregnant? Was she hiding her pregnancy? What exactly was going on? The bottom line, though, is that this teenager is now charged with murder. Here's her story. In Artesia, New Mexico, 19-year-old Alexee Trevizo went to the hospital complaining of back pain. She was there with her mother. The nurses and doctor took her in to try to figure out what was happening. As part of their evaluation, they did a pregnancy test. It was positive. But before any of this was discussed in the patient's room, Alexee left the room to go to the bathroom down the hallway. Alexee was in labor, alone in that bathroom. The baby was delivered, but when Alexee left the bathroom, she did not have the baby with her. A hospital employee discovered the baby later wrapped in a plastic bag in the trash. From that point forward, hospital employees went into action, but the child was dead. It was an incredible tragedy and a shock for Alexee's mother. Police were called and an investigation was started. Alexee was charged with first-degree murder, but there are still a lot of questions regarding what happened inside that hospital. We'll take a closer look as we investigate the tragic case of Alexee Trevizo and her dead baby. This story is extremely tragic, obviously, and extremely sad on many different levels, but it's also a little bit perplexing. Primarily because of the setting of where all this is taking place, which is the hospital. So the first thing that really struck me is the video. And I want to take another look at the video of her as she makes her way to the bathroom where she gives birth. She's running down the hallway in the hospital, holding her backside, opens the door, goes in there, locks herself in for 18 minutes as they try to get in, and then she walks away. And I'm wondering what's on her mind as she's making her way to the bathroom. What is she thinking about? What does she know at that moment? And why is she going there? Which brings me to my first question tonight. And I think this is a significant one, and we may think it's a simple answer, but maybe it's not so simple, and it has to do with this defendant, Alexee Trevizo. Did Alexee Trevizo know that she was pregnant? Did she know? Let me bring in some experts to try to figure this out. Joining us, dual board certified OBGYN, Dr. Greg Marchand is with us. Also joining us, teenage pregnancy counselor, adolescent psychologist, and licensed mental health and nationally certified clinician, Sharonda Brown is also with us. Thank you both so much. I'll begin with you, Sharonda. I want to begin with you. Do you think she knew that she was pregnant?
It's very possible that she did not, and I know that it may sound bizarre, but one thing that happens with teenagers, especially when their body goes in shock, they disconnect from their bodies, and sometimes they depersonalize their surroundings, and they have a derealization, which means they detach from reality. And there are times where they may develop these psychosomatic symptoms, or they may detach from the symptoms altogether so that they don't feel anything until they're in a crisis, which is why it's possible that she's like, hey, I'm having back pains, and I need to go to the ER, and at some point, realize like, oh crap, there's a child coming, literally. And this is where that reality may set in or kick in, but that is very, very common with a lot of teen pregnancies. Most of the time they don't know because they're already being naive about the fact that it can actually happen to them and that it will happen. And they went on with their lives carelessly as if they're not with child. So this does come as a shock. And I know that it may sound very bizarre, but this is a reality for a lot of teen parents.
Dr. Marchand, what does your experience tell you?
I agree with a lot of what she said. I mean, there's really no way that a woman of normal intelligence without mental impairment is going to go months without realizing they're pregnant. That's basically an impossibility. But as she just brought up, there's a very real possibility of pathologic denial here. A woman with some psychological disease who keeps pushing down the possibility that she's pregnant, even though she's feeling movement in the belly, even though her belly is growing, and she seeks out things like weight loss drugs. That is a possibility, but in a normal, healthy woman, they're not going to miss pregnancy.
Now, the two people who are closest to her at that moment, right, would be, I believe, her mother and her boyfriend, who we believe was the father of the child. I want you to take a listen to their discussion. It's caught on body cam video, and this is at the hospital. Let's watch.
So what did she come here for that she told you?
She told me she had back pain.
That's it?
That's it.
Okay. Has she been having back pain before?
Yeah, pain for her and her hips is no, I mean, she was born with like her, I don't know, it was like crooked.
Her spine?
Okay, because my ex-husband, he hit me. He beat me whenever I was pregnant with her. So she was early. So she had some problems with her hips. Like I always had to take her to the chiropractor to get adjusted because she couldn't use it, like she was always getting constipated, like she had to get lined up, whatever. So, I mean, I've been taking her to chiropractor because I always thought, well, this time, I didn't know. I honestly didn't know she was pregnant. I didn't know. I just thought, like she said, I had back pain, Mom, my hips are hurting me. I think I need to go to the chiropractor. I said, okay, let's go tomorrow. But she was like in really a lot of pain and,
When did it start?
Like the pain?
Yes.
Yesterday she said it was really bad, that her hips were hurting and her back. And then last night we were on the phone together and she said her hips were hurting bad. I asked her if anything else was hurting, and she said just everything. And she went to sleep.
But she's a cheerleader too, so she's big in cheers. They have cheer competition. She works out. I mean.
And she's been active this whole time?
Yeah, she's been active this whole time.
Doctor, how about the fact of being active the whole time? What sort of impact can that have on your knowledge or the way you feel?
Well, it's certainly an unnecessary risk to this pregnancy. I mean, we saw her doing cheerleading things on the video. She easily could have fallen on her tummy. But I do think that fits with the type of pathological denial you probably saw here, saying that it's okay to do these things, okay to not take care of your body, because you're in denial about the fact that you're pregnant.
Sharonda, I want to show you a picture that was posted on an image from TikTok, Evan the Plug on TikTok. And this is a cheerleading still. And anytime I've shown this photo to anyone, they're like, oh, come on. Come on. She didn't know she was pregnant. Everybody on the cheerleading squad didn't know she was pregnant. Everyone in the school. How could not anyone know? What do you see when you see this photo?
I mean, I see a belly. I see possibility of pregnancy. But with someone who's in denial, you have to understand denial is a very, very powerful thing, especially when it's not on someone's radar. If you go looking for a red M&M and a pile of purple greens, you're looking for the red M&M.
How about for the people around her in her life, Sharonda? I hate to cut you off, but how about the people around her in her life, if they see this?
I think it's possible that they too can be in denial, especially if there's the concept. You have to think too, there are a lot of families who do not talk to their children about sex, who don't talk about what you're supposed to do in the event that you have unprotected sex. So no one is going to admit that this is a possibility. And it's not because it's not reality, it's because it goes against their reality. And people will advocate for their reality. They will fight for their reality to stay whatever they think it is. Even if it says, I can see this belly, it's possible that she's pregnant, but I don't want to address that because we're not even supposed to be having sex unprotected. It's that powerful. These are the things I deal with regularly.
I want to take a listen to what the charge nurse had to say in this. Again, this is a part of an interview in what happened here, but I think this is pretty insightful.
It was a regular night. I remember she came in with back pain, and they had put her in. They were going to treat her in triage 1 with some regular medications for back pain. But after the doctor examined her, she was a little concerned, I think, because of her heart rate and some other things. So she wanted to move her into a room and do a more extensive workup, which is what they did. He came to me and said there was some issues because they had ran a pregnancy test on her and they found out that she was pregnant. And she was adamant, the mother was in the room with her and was adamantly denying to.
Did you see that? Or did it was?
No, Chris came to me and told me this was what was going on in the room because we were having an issue.
Okay.
And he was worried about the mother, the dynamics between the mother and the daughter, because the daughter was completely denying she was pregnant and the mother was relatively upset about that she was pregnant.
So there are a couple of things that are interesting there, but first, Dr. Mershon, the fact that I guess it's not even obvious necessarily, like, to medical professionals that she's necessarily pregnant as soon as she walks in. So maybe you need the test to figure it out, that it's not just, oh, you look at someone and say, oh, you're pregnant.
No, that's not going to be the case. I mean, that's very unfortunate. A very poor level of medical care, probably malpractice. Now, I absolutely agree with everything my colleague had said, that this woman was in pathologic denial to convince herself. She used that denial to manipulate her family and hide her belly bump. But as soon as that physician examined that patient, should have immediately realized this is a pregnant woman, should have immediately realized this isn't a back pain issue, this is a labor issue. And then, of course, soon enough, one of the last signs of labor before you deliver is a severe pain in the buttocks that often feels like you're going to have a bowel movement. And you see her grabbing her behind there, running to the bathroom. That should have been picked up by the ER doctor, absolutely. It's very, very unfortunate it wouldn't. Now, based on what happened, I don't think it would have changed anything, but it's very unfortunate. The medical professional should have caught that quickly.
It is surprising. It is very surprising. And again, that's the one part of this story that makes it so different than any of these other cases that unfortunately happen, is that this one is happening in a hospital. So when we come back, we've got more to discuss in all of this. And we're going to ask the question, and I think the doctor's got a pretty strong opinion on this. Did the hospital do something wrong here?
She came in, she was triaged with lower back pain, uncontrollable. We were going to give her some PO meds, but the doctor said, no, let's just start a line on her. So we put her in there, gave her some pain meds. She was complaining, so about the pain, and we're like, okay. Then we checked her for pregnancy. She tested positive. So we're like, okay, let's get an ultrasound, make sure, you know what I mean? Then she told them that she needed to go to the bathroom.
Was a reporter brutally murdered for digging too deep?
His death was absolutely devastating.
The suspect, a former politician and subject of the victim's story on corruption.
Can you tell us anything?
Now will Robert tell us, go from elected official to convicted killer.
Once all the evidence comes out, it'll be clear as day.
Is it possible that bad press is a motive for murder?
The Investigative Reporter Murder Trial. Live coverage weekday mornings on Court TV.
If you have a woman of childbearing age in the hospital and she's complaining of low back pain, you make certain she's not pregnant. I mean, it's a simple test. It came back quickly. It came back on the computers. Every nurse that was taking care of her and the doctor all knew at 12:51 that she was pregnant. They did not tell her. And then at 1:39, they unhook her from the IVs and allow her to go, not to a bathroom in her room, they had her go down the hallway to a public bathroom in the emergency room.
That's the attorney for Alexee Trevizo representing her, and he fully is pointing the finger at the hospital in all of this. Now, while Alexee Trevizo is facing first-degree murder charges, she is suing the hospital. And in those papers, they've outlined a timeline of what they believe happened that day, that night inside the hospital. Let's take a look, because we've got it outlined for you here. At 11:47 p.m., first, Alexi attended school and a 3-hour cheerleading practice, right? January 26th, 2023. 11:47, she goes to the emergency department complaining of back pain and ranks it 10 out of 10. It hurts. 12:05, she is seen by a physician and she says she's not pregnant and needed to have a bowel movement and informed the doctor she was on her period. Okay. 12:28, doctors begin administering morphine and lab tests are ordered. 12:51 a.m., doctors receive a notice of positive pregnancy test. Morphine treatment continues. 1:39 a.m., Alexi informs the staff she has to go to the bathroom. Nurses remove the IV, and you've seen the video. She runs down the hall. At 1:57 a.m., Alexi exits the bathroom after giving birth by herself, locked in that bathroom. 2:38 a.m., the infant is pronounced dead. Now, obviously we know what prosecutors think here. They think this is murder. She is responsible, but is there more responsibility here? And that brings me to my next question, which is about the hospital. Did the hospital do something wrong in the treatment, in the care, in the way they handled the situation? Still with us, dual board certified OBGYN, Dr. Greg Marchand. All right, where should we start? The way I want to go through this, I'm going to go through the timeline, little pieces. You tell me what you think should happen at that moment. If she complains of back pain at 11:47, 10 out of 10, then at 12:05 sees a doctor, says she isn't pregnant and needs a bowel movement and informed the doctor she was on her period. What should happen there?
At that point, the doctor, if they have any experience, should lay their hands on the patient and realize this is almost certainly a 9-month pregnancy or a very large abdominal tumor. You may not be aware of this, but occasionally teenagers can lie, and an ER doctor needs to be very careful about what they believe in the patient's story. And very quickly after that, they could have used an ultrasound probe to verify that they were pregnant or done a number of things, but they would have needed to really start moving the transport to somewhere where they had obstetrical capabilities. And my understanding is they didn't have obstetrical capabilities at this hospital. It's a little silly and disturbing that they had to wait until a pregnancy test came back and really didn't even seem to be suspicious of pregnancy on initial presentation when she showed up in back pain that eventually turned out to be labor.
How about the administering morphine at 12:28? Obviously, she's in a lot of pain.
Yeah, I don't really have a problem with administering the morphine. That's not going to cause any problems with the pregnancy. It would be better to be monitoring the pregnancy, but at this facility, they don't have pregnancy monitoring capabilities, by my understanding. I'd also heard that she was given ketorolac as well, which is something you wouldn't want to use in pregnancy because of the effect on the fetal heart. So that may have been another mistake they made, although it wouldn't cause an effect immediately on the fetal heart. Had the baby survived, it could have caused problems down the road, but not immediately.
Okay, this is a big one for me. 12:51, the test comes back positive, right? They get the results. The morphine continues, but at 1:39, they get the results 12:51. At 1:39 a.m., she tells the staff, I have to go to the bathroom. They unhook the IV, and she goes into the hallway and runs down and ends up locking herself in. Is that problematic for you?
Not as problematic as missing the pregnancy to begin with. At this point, I assume the physician knows she's pregnant, but she doesn't seem to be in the final stages of labor. So there's no monitoring at this hospital. So they're not really making things more dangerous by unhooking her from the bed. And the assumption for the physician would be if this woman was suddenly in labor, any reasonable woman would call the call light, scream for help, or there's actually in most ER bathrooms a cord that you pull to say the nurse has to come in right away. I don't think there's any way the ER doctor could predict her doing something like the events that happened. So I really wouldn't fault them for letting a pregnant woman go to the bathroom. Of course, nobody wants a pregnant woman to deliver her baby in the toilet, but as long as that woman's going to call for help when the events unfold, it shouldn't be any type of dangerous situation.
So, and that brings me to the next question, which is about the baby. And I'm not talking about murder, I'm not talking about criminal charges here, but do you feel there's any level of responsibility for the death of that child on the hospital itself?
No, I don't feel the hospital's responsible for the death in any way. I am a little outraged by the events that happened. Every good ER doctor I've ever met, I think, would have laid hands on this patient and known they were pregnant right away. But I don't think they're responsible for the death. those actions that occurred after the baby was born were really quite unpredictable. Even if you were to believe that she didn't know she was pregnant, to take that set of actions is just so unnatural for a woman. If you look at the scenario, a situation like that, you might not be able to hold the baby. You might scream for help. You might try to warm the baby. You might do a number of things. But to go ahead and get a plastic bag and then dispose of it and then put on the face that nothing happened, that really speaks to somebody who's thought a lot about this and has a plan for what to do when the baby comes and to plan to continue living their life as if it didn't happen.
And how about dealing with someone, now she's a teenager, but she's not 13, she's not 14. She's an adult, but a teenager, 19 years old. What are your thoughts about handling someone of that age? Are they handled differently than perhaps, someone in their 20s or 30s?
Well, from a psychological perspective, I do believe that she was exhibiting signs of pathological denial and was lying to herself over and over. Generally, in most states, when someone is pregnant, they are considered an adult for purposes of pregnancy and the care of the child. But again, it was those events after she delivered that really showed us that something very evil was going on here. You would have expected a mother, even one who wasn't expecting a baby to pop out, to at least show emotion and want to care for the baby, hold the baby, or on the other hand, they could have been so concerned about their own well-being. But this woman didn't exhibit any of those behaviors and instead somehow knew what to do with the placenta and wasn't calling for help or wasn't asking for medical attention when the placenta is coming out and bleeding is going on. These would be very frightening things for somebody who hadn't looked up what was going to happen.
Absolutely. Doctor, we're out of time. Appreciate your insight. Unbelievable. All right, folks, I'm Vinnie Politan. We'll keep digging for answers as the investigation continues. I'm Vinnie Politan. As we continue our investigation into 19-year-old Alexee Trevizo, we enter the world of hidden teen pregnancies. Now, this one is a little bit different because Alexee is charged with murder for something that happened inside of a hospital. Here's the story. 19-year-old Alexee Trevizo went to the hospital with her mother complaining of back pain, then went into labor and delivered a baby by herself in the hospital bathroom. The baby was then wrapped in a plastic bag and placed in the trash and was later found dead by a hospital worker. Alexee is now charged with murder, but she says the baby was stillborn. This case has raised many questions about what was happening inside the bathroom and the circumstances surrounding Alexee's pregnancy. This happened in a hospital. I still can't believe that this happened inside of a hospital, but it did. But it happened inside the hospital bathroom, and the child was discovered by someone who went inside to clean up and discovered that baby. That worker from the hospital was interviewed and described what she found. Let's take a listen.
So when I went in there, it was a bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall.
Do you remember which wall?
The one behind the toilet, and then the one on the side right here. You know, there's the one where the toilet sits, back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere. I mean, it was.
Was it like this? Like this is the bathroom. Here's the toilet and the sink. Then here's the door. So was it just like this, or?
Actually, it was all over the place, all over the floor. Because even when I was going into the bathroom, there was blood coming out of the bathroom on the floor.
Okay.
So it was everywhere.
Okay.
So there's blood coming out of the bathroom? Do you know how far?
Footsteps.
Okay.
I think there was the person that was in there, her footsteps. I started cleaning. I started first thing I did was I started mopping because we couldn't be walking around on that blood.
Okay.
So I started mopping, and then I started, after that I started wiping everything down. Then I went to the toilet, and I cleaned the toilet, and then I got everything, I had to do everything like twice because it was, bad. I wiped down the walls and everything, and after I did all that, I usually throw my trash first, but for some reason that night I had to clean the floor up and everything else. And when I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was there was trash in it, but I knew that it felt like when I picked it up, it was some weight, so I thought it was the trash bags, because we put the trash bags on the bottom. Mm-hmm. And so I started getting the trash out, and then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like in the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, like as soon as you picked it up?
No, after I picked up the trash bag that was on top,
okay,
where they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
Okay, so you lifted the liner and then saw
Yeah.
baby, okay. And I know it bugs you, but can you describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that. And he was like purple, pink and skin type color.
I can't imagine what that moment was like for her. And then how about for Alexi being inside there? Which brings me to my next question. We've heard the scene described, but what happened inside that bathroom? What happened? Still with us, dual board certified OBGYN, Dr. Greg Marchand, and also joining us, clinical and forensic neuropsychologist, associate professor at Pepperdine University, and author of the book, The New Rules of Attachment, Dr. Judy Ho is with us as well. Dr. Marchand, I want to start with you first. How does someone, what do you think happened? How does she deliver a child inside that room by herself? Like, what is going on?
Well, it starts out with her running down the hallway. You see holding the buttocks area, which is one of the final signs for delivering a baby. If you were to go into a OB triage emergency room, if you say out loud, I feel like I'm going to have a bowel movement, all the nurses will jump up and know that it's probably close to delivering a baby. But after she gets through the door, she most likely used some sort of squatting technique to deliver the baby. From the fact that she was walking without any kind of impairment, I don't think the morphine helped a lot. So that's one moment that really makes us think, what is going on here? How is this woman not screaming for help? As the delivery starts, if you don't have an epidural, a normal person at this point is going to scream for help, hit the call button, help me, something like that. But none of that happens. Instead, she delivers the baby, and then we've got another important moment here where the baby's out. Now, while it is true that in some cases, some babies don't start breathing right away, don't start moving right away, in no case is it going to be normal at that moment to take the actions that she took about using a plastic bag, finding a way to separate the umbilical cord from the baby, and then delivering the placenta. None of these are intuitive actions that a person would do. All of this had to be at least somewhat pre-planned of what she was going to do, including putting the baby in the bag and then arranging other things in the garbage on top of it. But that's really the scary moment, that after the baby's born, she's not screaming for help. She instead has a plan to deliver the placenta and then to try to hide what happened.
Dr. Judy Ho, put us into the mind of this 19-year-old inside that bathroom, locked by herself, delivering a child.
I mean, it sounds like she really didn't know what she was going to do in that moment. I think that, like Dr. Greg just mentioned, there may have been this element of it being pre-planned, but of course this is a young mind trying to figure this out. And even if she decided she didn't want the baby, clearly her ideas to cover this up, to do something about it. It was somewhat rash in the way that a young adult, a late teenager would be pre-planning something like this. And so what I really want to understand is, how she was able to go through it after seeing the baby. There was no connection there. There was no just biological, intuitive, maternal instinct of, okay, well, I came in here with one plan, but now I'm second guessing myself. I really wonder what was going on that made her carry this all the way through to the sad tragedy we have now.
Absolutely. Let's take a listen to the charge nurse here describing how the baby was wrapped.
What did the bag look like?
The bag was the original trash bag that was in there. It had trash in it. When I pulled it out, it was spun, or it was tied, and then it was folded underneath the baby and in there. So it was like a little capsule the baby was in. So when I had to tear that bag open to see the baby in the bottom. If you would look in the trash, I looked in there. When she told me, she goes, something. I said, what are you talking about? Because there was a clean liner.
So basically, he was in the bottom, trash on top of him,
and then another clean liner had been put on top. I knew then we had a serious problem. I immediately I just grabbed the trash can and went right across the hall into trauma 2. Their liner was pulled out, but there was another trash bag in there in the bottom, but it was all it was rolled up. So I had to tear it apart. And then, of course, I saw the baby in there. So I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever.
Dr. Marchand, now I know the plastic obviously would have an impact on the baby's ability to breathe if the baby survived. This will be a battle inside the courtroom to figure that out. However, if the baby was alive and was born alive and wasn't in the plastic, but is immediately after birth placed into a trash bin and left there for an hour or so, do you think the baby could have survived?
Well, I think the biggest factor there, as was later shown in the autopsy, is how tight the bag was wound. And my understanding of reading the autopsy report was that the bag was wound very tight and there just was no oxygen. It's really heartbreaking to think about, but it did seem that the baby succumbed to the fact of using all the oxygen in the bag and then passing away because there was just no air left. It's a horrible way to die. It's certainly something that boggles the mind.
Dr. Judy Ho, I want you to take a listen to Alexi and her mother reacting to the news that a baby was born and that baby is no longer alive.
I'm sorry. We discovered a dead baby in the bathroom. Oh my gosh. I'm sorry. He came out and I didn't know what to do.
Lexi, I told you about this.
But
I just asked you, baby, to tell me the truth.
Scared. It was not crying or nothing.
What did you do to it?
Okay, stop right here. Stop. Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly.
Yeah.
I've spoken to the obstetrician at Loveless. They want her out there as soon as possible.
Okay.
I obviously need your permission to transfer her for medicals. She's
19.
Oh, you're right.
But she is a student too.
You're right. You're right. She needs to. I'm sorry, I forgot she's 19.
Keep having me.
But you need to make sure that you're safe. I need to send you to Loveless to labor delivery. Will you please agree to that?
Yes.
Okay, great. I'm gonna work on that. I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
Dr. Judy Ho, your thoughts about the mother-daughter reaction and relationship here?
I mean, it just seems like something's really off. First of all, Alexee's reactions, the way she was reacting, I mean, she definitely looked like she thought she was in trouble, but also just her demeanor was so odd, like just her face, she was kind of grimacing, but kind of like scared or surprised that something like this would happen, that she would actually have to have the police involved. The doctor seemed honestly quite disgusted with the whole situation. She seemed really stressed out, impatient, like just agree to the medical care. We need to save your life at least. And then just the mom, I mean, the way that she just stood up and said, what'd you do to it? What'd you do to the baby? I talked to you about this. Are we talking about a human life here? What was discussed before this? I don't know what was going on, if she thought that maybe she was going to be punished, if her mom thought that she was having a baby. But regardless, this is not what I would imagine would be a normal spectrum reaction between mother and daughter after something like this.
Big thank you to our guest, Dr. Greg Marchand, and of course, Dr. Judy Ho. Be sure to check out her book, The New Rules of Attachment. Still to come, why would a teenager hide her pregnancy?
Lots of young girls come in and find out they're pregnant, and then of course they deny it. It's not uncommon that they deny that, no mom, I haven't even been having sex.
One of the most successful true crime TV shows ever.
This is crazy.
Now has a new home on America's original true crime obsession, 48 Hours on Court TV. Coming up next on Court TV. Join Court TV's Vinnie Politan with the latest and breaking true crime stories.
Now, let's look at the other side of all of that.
Vinnie Politan Investigates. Weeknights, 9/8 Central. Only on Court TV.
Lots of young girls come in and find out they're pregnant, and then of course they deny it. It's not uncommon that they deny that, no mom, I haven't even been having sex. You know what I mean? That's a lot of them's initial reaction, because you know they feel like they're going to be in trouble. I guess I don't know what they're feeling, but that's not an uncommon reaction that I see with young girls and their mothers, particularly with their mothers in there or father, that they'll deny that they've had sex. That's pretty common.
Unfortunately, through the years at Court TV, we've covered a lot of cases involving hidden pregnancies by teenagers, and oftentimes ending with harm to that child. Now, one of the most high-profile ones that we covered recently was a few years back. Another cheerleader, by the way. Brooke Skylar Richardson was her name. She was from Ohio, and she went to trial. She had hidden her pregnancy, and really a very emotional, dramatic moment in the courtroom. She was found not guilty for the death of the child, but was still found guilty of some charges, and spoke before she was sentenced.
Richardson, you get the last word in all of this. Is there anything that you want to tell me before I impose a sentence?
Thank you, Your Honor. I would do anything and above that you ask, and I understand. And I just wanted to say how sorry I was. I can sometimes be selfish, but I would like to think that I've become better in the knowledge that I've upset everyone and hurt so many people with what I've done, and I'm forever sorry, and I'm so sorry. I'm really, really sorry, and I understand, and thank you.
This was after she completely broke down when the verdict was read. It was a very impactful moment inside the courtroom. Now, you heard the apologies, right? Like, she sees the light now. But that brings us back to our question, and my next question, which I think is significant in this entire discussion, which is, why would a teen hide her pregnancy? What's behind all that? Back with us, teenage pregnancy counselor, adolescent psychologist, and licensed mental health and nationally certified clinician, Sharonda Brown. And joining us now, author of the book, Saving Skylar, the Brooke Skylar Richardson case, Sonia Chopra, is with us. Sonia, why did Skylar hide her pregnancy?
It was a combination of extreme fear, denial, and ignorance. Ignorance because she had these eating disorders and she rarely had a normal period. She suspected she was pregnant for the first 1 month, but when her period came, she told herself it wasn't possible. And she was extremely frightened of her parents' reaction. And she just didn't think it would happen to her because she had sex once, unprotected sex just once.
Let me ask you, Sharonda, Why? Why would a teen hide her pregnancy?
Everything my colleague just said, from denial, shame, guilt, not understanding the consequences, partially, sometimes rape, abuse. The child is a product of that, and they don't want anyone to know. And moreover, they don't want the consequences or the shame, or they don't want to displease their parents. And what I've seen is a lot of the times the teen girls are pregnant by mom's boyfriend, or by someone mom knows, and they don't want to ruin mom's relationship. So they will cover it up, and they will not tell anyone.
Sonia, you know, we go back to the sentencing of Skylar, and there was such, it seemed like there was such genuine remorse there. Has she made it through all of this? Is she on the other side? Is she getting back some relative normalcy to a life that will never be 1,000% normal?
She will never be completely normal. She's still haunted by the trauma. What if she had done things differently? What if she had called 911? Her baby would still be with her. She spends a large amount of a Sunday at her baby's graveside, and she has found some love and some peace. She's married and happy. She still works at the same attorneys, and but her traumas are not going to be behind her. She doesn't believe she'll ever be normal. And the public opinion is still very against the whole situation, and people still haven't forgiven her.
Sharonda, do you think, Sharonda, that for a teenager like this, nothing could be a bigger moment, right? Like, in many different ways, like it's overwhelming that you're a teenager and then all of a sudden you're carrying a human life. That's a lot for someone young to handle. And does it warp their sense of reality and their sense of this is a life that I'm carrying?
It most certainly does warp their sense of reality. It changes their life. It alters the way they think, the way they feel. Their life has changed. It's not the same anymore, especially if you have concerns about raising that child on your own. A lot of times parents will tell their children, you have a baby, you're out of this house. You have a baby, I'm done with you. You have a baby. That's the one thing they worry about the most when their teenage girls become teenagers is don't get pregnant. You hear that more than anything. So when you do have a child and you do become pregnant, that's the first thing you think about is my life over? Are my parents going to shun me? Are my friends going to leave me? Am I going to be judged? Am I going to be seen as promiscuous? What are people going to think? And all of that changes the way that the young women operate. And it's not an easy task. It's not something that you can easily adjust to. And even myself as a teen mom, I literally had to change my lifestyle, leave the city that I was in, and have a new life. And that was the only way I was able to successfully carry my child and have my child without the shame and the guilt.
Sonia, we have about 20 seconds here, but are Skylar's parents, they seem supportive during the trial. Are they there for her? I think we have a difficulty with our connection to Sonia. I'm so sorry. But I do want to thank our guests so much for joining us, Sharonda Brown and Sonia Chopra. We appreciate your time and your insight tonight. We all know that being a teenager is very, very difficult. So many issues that they have to deal with. And now with social media and everything else, it's gotten even more complicated. Then add on top of that being pregnant as a teenager and having to deal with everything children deal with today, and then have that with you, right? And of course, the biggest fear is always the response of the parents, that they're going to throw me out. They're going to get mad. I don't want to deal with it. The bottom line, though, is those parents, mom and dad, when that child's born, become grandma and grandpa. And when that moment happens, they're going to love that baby. And I just wish every teen who is pregnant realized that. I'm Vinnie Politan. We'll keep digging for answers as the investigation continues.